Hi, this is Vincent Picard. In my presentation, I'll be talking about mad honey. So mad honey has a calming or relaxing effect when you take the prescribed or recommended dose. But in higher doses, it can be very hallucinogenic, and it contains granulotoxins, which are the main psychoactive component found in mad honey, which comes from the rhododendron genus of woody plants, of which there are 1,024 species. The bees pollinate these plants and create the honeycombs from which this honey is created from. And there are 3 species which are known to contain this granulotoxin from which this mad honey is made from. Now there are 25 granulotoxin isoforms from which have been isolated from rhododendron, 3 of which include GTX1, 2, and 3, which are found in mad honey, with GTX3 being the most prominent and 1, 3, and 4 being the most toxic. Our luteum, that's one of the plants from which mad honey is made from, ponticum, and simsi. It's harvested in the Kashgar Mountains of Turkey, the Himalayan cliffs of Lamjung, Nepal, and there are a number of good videos on YouTube which I would recommend checking out if you have the time. 2 of which film the Gurung tribe, and another 2 show the Kulong people as they harvest the mad honey in Nepal. Here you can see Nepal sandwiched between India and Tibet, and in the Himalayas on the north side. Here's the Himalayas again, Lamjung, and then Nepal, Kashgar Mountains, Turkey. Now the Gurung tribe are a tribe of Buddhists, and they perform a ritual called the puja, which is a Hindu term. The ritual consists of burning incense and offering prayers to invoke certain spirits, in this case the forest spirit. They provide a sacrificial offering, from what I saw was a chicken from the videos that I watched, and they do this in order to guarantee a successful harvest and to ask for permission from the spirits. And this is to guarantee protection and so nobody falls, because it is a very dangerous job, as you will see. They pray once at the bottom and once at the top. Here is a screenshot from the Vice documentary on mad honey. Here's a better quality image. Here's where they are harvesting the honey from these rope ladders, which they fashion once they get to the top of the mountain, I believe, and then they use these bamboo poles to knock the honey into a basket, which they then pull up from a rope. Here's another picture of a man with a bamboo pole in the basket with the honeycomb in it. And here's a couple more pictures, and then here's a picture of a man holding the basket with the bamboo pole as he knocks the honeycomb into the basket. Here's a picture of some honeycombs, and then to get the bees this docile, they have to smoke them out by burning some brush, and then bees allow them to basically take their honeycomb from them because they become more docile as a result. That's why that man was able to do it with very little protection, as was seen. He was basically barefoot harvesting the honeycomb. Now, some symptoms or side effects include an audible disturbance or buzzing, a distortion of vision, dizziness, imbalance, nausea, and vomiting. Those were the more common effects I saw from the videos of people using it that I saw. Some other effects include a lot of cardiac disorders, which you can read here, and then some other symptoms including vertigo, headache, diplopia, pins and needles, burning feeling in your extremities, ataxia, convulsions, hypersalivation. The main reason why it causes a lot of its effects is because of the fact that it binds to voltage-dependent sodium channels on excitable cell membranes of the heart, nerve, and skeletal muscle, which causes an increase of sodium calcium ions into the cell, which prevents the channels from inactivating, and it causes them to remain in a depolarized state, which causes an increase in parasympathetic tone, which leads to bradycardia, hypertension, atrioventricular block, and potentially a complete atrioventricular block. This is very fatal. And not as common is atrial fibrillation, asystole, which is flatline, and myocardial infarction, which is a heart attack. It also binds to the muscarinic M2 receptors, which are located on the heart, and this mediates tremor and hypothermia. The M3 receptors are located on smooth muscle, gastric, and salivary glands. The M4 and M5 receptors are on the hippocampus and substantia nigra. Here are the location and function of the different muscarinic receptors, M1, 2, 3, and the M1, 2, and 3. And then a lot of the effects that are caused, that create the parasympathetic state, is due to the stimulation of the vagus nerve, and so the vagus nerve actually creates 75% of the PSNS, which is the parasympathetic nervous system, and this branches into many key organs, including the stomach, kidneys, bladder, and reproductive organs. And the vagal tone can be measured when you compare the difference between the heart rate when you breathe in, which causes it to speed up, and when you breathe out, which causes it to slow down. Higher vagal tone has a lot of benefits, just general good health, and then stimulating the vagus nerve also stimulates the PSNS, as I mentioned earlier, which causes that lowered stress, lower heart rate, and blood pressure. It also affects the limbic system, which is where emotions are processed, and stimulates that rest and digestion and better feeling of well-being. For intoxication treatment, if you're experiencing bradycardia and severe hypotension, they'll generally give you IV infusions of atropine sulfate and saline infusions. The atropine has an opposite effect on muscarinic receptors, so it's an antagonist, and so it causes dry mouth rather than hypersalivation. And if you're experiencing a complete atrioventricular block, a pacemaker may temporarily be used, and they may also use vasopressors, which are antihypertensive agents, which are pretty much any medication used to lower blood pressure. There haven't been too many incidences of fatalities, except for one incident that has been reported in Southwest China. But it can lead to arrhythmias, which can be threatening, especially because it's hard to be aware that they're happening sometimes. Rhododendron does have some medicinal uses, including for heart disease, dysentery, diarrhea, inflammation, fever, bronchitis, detoxification, constipation, asthma, and other studies show potential as an antioxidant, antimicrobial, analgesic, antidiabetic, immunomodulator, and for its hepatoprotective and cytotoxic properties. It's also been used for GI disorders such as peptic ulcer disease, dyspepsia, which is indigestion, and it's been consumed by the Anatolian people to treat gastric pains, bowel disorders, and hypertension. In Turkey, it's been used in traditional medicine to increase appetite, mental alertness, suppress joint pain, GI pain, and as an aphrodisiac. The aphrodisiac part I'm going to get more into later. And then it also has been used, it can be used as an analgesic and to lower blood pressure and heart rate, as seen in mice models of acute pain and painful diabetic neuropathy. Now I'm going to be focusing on the reproductive system, which is made of organs, fluid, and hormones, which are related to sexual reproduction. The primary organs being the ovary and testes, which are the gonads. The testes produce sperm, and the ovaries produce eggs, and they both produce hormones and pheromones. The secondary parts include other glands, ducts, and organs, which assist the reproductive process in stabilizing the offspring, which is the fertilized egg. 40 to 50% of testosterone is made in the adrenal glands and ovaries of females. The hypothalamus sends GHRH to the pituitary through the blood, which tells the pituitary to release FSH and LH, which are gonadotropic substances. The LH promotes production of testosterone in the gonads. The Leydig cells in the testes of men turn the cholesterol into testosterone, and the FSH promotes the creation and maturation of sperm cells in men and eggs and ovarian follicles in females, as well as estrogen and progesterone are also created in the ovaries of women as well. Testosterone in men has a lot of positive effects on sexual function, including increase of libido, which is also present, seen in women as well. And then many issues can arise when you have too much or too little. It helps with a proper ratio of lean body mass, lean to fat body mass, increased bone density, cognition, focus, memory, cardiac capacity, heart health, red blood cell production, lean muscle mass, motivation and productivity, sleep and balancing mood. Women produce less testosterone, which is why they have a decreased bone mass and muscle tissue. Here are a list of benefits to testosterone. And then too much testosterone can cause, surprisingly, a decrease in sperm count, testicle size, and potence, and also many symptoms seen with void rage, as well as other problems. The lack of testosterone can cause, as you can imagine, less body hair, facial hair, muscle mass, lower libido, impotence, smaller testicle size, less sperm, and so on. Can lead to lower sex drive, erectile dysfunction, inability to orgasm, which is why people use the mad honey to help assist with this. And this can be brought on due to aging, obesity, and heavy drinking. It has gained popularity as an aphrodisiac and a sexual stimulant. Many claims that honey increases. There are many claims that honey increases nitric oxide, which increases blood flow through the body, which can help with ED potentially. Honey also contains other vitamins and minerals like boron and zinc, which may help with the production of testosterone, sperm cells, and estrogen. But the main distinguishing factor between mad honey and other honey, of course, is the granutoxin, which can produce euphoria combined with the boron and zinc, which can help with sexual arousal. And the nitric oxide can relax vascular smooth muscle and acts as a vasodilator and allows rare blood flow throughout the body, which includes the sexual organs, helping with that ED. Mad honey has been shown in mice to increase testosterone significantly. and researchers believe that this could be something to do with the hypothalamus and the pituitary. In smaller doses, this may help with lowering blood pressure, but in too high of doses, it can be toxic. So I would advise being careful with this stuff if using it at all. There are 3 websites which say it does also help with enhancing vaginal stimulation in females, but I do not know if this is true. I couldn't find any actual hard evidence on this. And then there are also 2 of these websites which describe, which say how honey does contain B vitamins which promote testosterone production and regulates hormones and energy, increases energy. And one of which also says the boron content can increase testosterone as well as help in the metabolism and utilization of estrogen. However, it's most likely the gray anotoxin, which is what causes the aphrodisiac effects seen. And this is actually why a lot of South Korean men tend to use it. Had an incident where there was an increase of use of South Korean men, middle-aged men who used it to treat erectile dysfunction, but then ended up in emergency rooms because they took too much, and this led to a government ban of imports of mad honey. So I would advise against using it because of the side effects which have been seen with mad honey.